હેલો ફ્રેન્ડ્સ, તો આજે ઓબીજીમાં એક ઇમ્પોર્ટન્ટ ટોપિક જોઈશું જે છે પ્રી-એક્લેમ્સિયા. ફર્સ્ટ ઓફ ઓલ વી કેન સી ધ ડેફિનેશન ઓફ ધ પ્રી-એક્લેમ્સિયા. Pre-eclampsia is a multi-system disorder. It is characterized by the development of hypertension after the 20 week of gestation, proteinuria in a previously normotensive and non-proteinuric woman. ટૂંકમાં સમજીએ તો કે આ એક મલ્ટી સિસ્ટમ ડિસઓર્ડર છે. ડ્યુરિંગ ધ પ્રેગ્નન્સી વુમનમાં હાઇપરટેન્શન અને પ્રોટીન્યુરિયા જોવા મળશે. નાવ વી કેન સી ધ ઇન્ડિકેશન્સ ઓફ pre-eclampsia. Pre-eclampsia is mostly seen in the primigravida woman and also in 5% in multigravida woman. Now we can see the causes of pre-eclampsia. The main causes of pre-eclampsia is unknown, but there have some predisposing factors like the elderly or young primigravida woman. Also the family history like the hypertension, pre-eclampsia, also the placental abnormality, obesity, and lastly the low socio-economic status. Those all are the factors are affecting to the pre-eclampsia. Now we can see the classification of the pre-eclampsia. It is mainly divided into two types: mild pre-eclampsia or severe pre-eclampsia. Now firstly we can see the mild pre-eclampsia. In mild pre-eclampsia, the blood pressure reach to the 140 by 90 to the 160 to 110 mmHg. Also the edema in especially on hands and feet, proteinuria or suddenly weight is gained. After the another type is the severe pre-eclampsia. In the severe pre-eclampsia, the blood pressure rise to the 160 by 110 mmHg. Also we can see the edema on legs, hands, face, abdominal wall. Also there are the other signs and symptoms like the headache, nausea, vomiting, disturb in sleep, also the visual disturbance. Now complication. Firstly the maternal complication. During pregnancy, preterm labor, cerebral hemorrhage, acute respiratory distress syndrome. Now the during labor, eclampsia or PPH. PPH means postpartum hemorrhage. Now the fetal complication. Fetal complication માં જોઈએ તો intrauterine death, IUGR. Investigation to identify the pre-eclampsia. Firstly collect the urine 24 hours for the measure the protein in a urine. After the ophthalmoscopic examination and the lastly antenatal fetal monitoring. Management of pre-eclampsia. Delivery is the only the curable treatment of pre-eclampsia. Also provide the patient to completely rest or also provide the proper diet. In the diet daily provide the 100 mg protein and total calorie of per day is 1600 calorie per day. Also provide the medication, antihypertensive drugs to control the blood pressure of patient. Also measure the regularly progress chart of patient. In progress chart, blood pressure monitoring the every 4 times in a day. Also the status of edema, daily weight record or intake or output chart. Also maintain all the laboratory test. Nursing goal. The first nursing goal is to provide the rest and peaceful atmosphere. Also to monitoring the condition and prevent the complication by the providing the appropriate care. And lastly prolong the pregnancy until the fetus is mature. Now lastly the nursing investigation. First the regularly antenatal checkup. Encourage for the bed rest. Also provide the antihypertensive drugs. Continue monitoring the maternal vital signs. Also the monitoring the intake or output and the laboratory test. Also the required the equipment such as a airway, oxygen administration and the emergency medication tray should be ready. And lastly the also in severe cases the woman is admitted in obstetrical critical care unit. So friends, તમને કંઈ કન્ફ્યુઝન જેવું લાગે તો તમે કોમેન્ટ કરી શકો છો અને પ્લીઝ ધ લાઇક એન્ડ શેર ધ માય ચેનલ.